Why are we seeing so many people coming out of this pandemic with long-term health challenges associated with long COVID and negative responses and reactions to vaccines? What we're seeing in the people that approach us for help with these two things is that they present in very similar ways. Significant fatigue, brain fog and other cognitive symptoms, neurological and sensory issues, dysautonomia such as palpitations, cold intolerance, shortness of breath, as well as like histamine and MCAS type symptoms. What we know about these two things is they are both inflammatory triggers. The SARS-CoV-2 infection causes awakening up of the immune system to defend the body, and we get associated increases in immune activity and inflammation in response to that. And it's particularly those people that get inappropriate levels and overwhelming amounts of inflammation that get complications such as COVID-19 and long COVID. The vaccine, in a similar way, by design wakens up our immune system, and as part of the increased immune activity resulting from that, we get inflammation. However, what we're finding is that there is a pattern in the people that come to us with these two types of illness to explain why they have responded negatively with long-term consequences to these two one-off events. And that is, firstly, a pre-existing history of underlying inflammation before those events occurred. And secondly, a decreased capacity to deal with more inflammation. So that when they have an additional inflammatory triggering event, their body can no longer cope with it and it overwhelms the immune system, which leads to more collateral damage within the immune response and inflammatory response, which leads to more long-term symptoms. Inflammation is a completely normal process in the body in response to things like a vaccine or infection. And our body can deal with it properly if we have enough antioxidant systems to keep that inflammatory cycle contained. When we don't have the antioxidants to mop up and contain the inflammation, we get more collateral damage of more tissue, which leads to further inflammation and upregulation of the immune system, which leads to more systemic inflammation and more chronic inflammation. This then leads to mitochondrial dysfunction, damage of the more sensitive tissues in the body, such as the brainstem, the thyroid, neural tissue, and a shutdown of our stress coping systems, such as our adrenals. And we're finding a typical pattern in the people that come to us with these two types of illness, which have been contributing to this underlying inflammation. So firstly, genetics. So some people we're seeing have a genetic tendency to respond with more inflammation in response to an inflammatory trigger, or even an autoimmune tendency. Secondly is toxins. We're finding many people have an underlying high toxic load of things such as environmental pollutants, heavy metals, mold-related toxins. These things are often pre-existing and underlying, and they maintain the immune imbalance that's needed to respond inappropriately to one of these inflammatory triggers. Third thing is food. We know in our modern Western diet we consume way too many omega-6 containing foods such as bread, cereals, grains, rice, pasta, which all promote more inflammation in response to an inflammatory trigger, combined with things such as trans fats and highly processed refined foods. Fourth thing is infections. We're finding with quite a few people that they have pre-existing underlying chronic infections of things such as Epstein-Barr, herpes type virus, yeast or fungal overgrowth. And when the inflammatory trigger takes place, that overwhelms the immune system, so it can no longer do a good job of keeping these under control, and then these things start to flourish and causing problems. And lastly, trauma and stress. We know that trauma and stress can cause physical consequences in the body in the form of chronic inflammation. Now, we're finding in people that go down this route is that they have this underlying picture of chronic inflammation, but also an impaired capacity to deal with it or deal with more of it. And we're finding that the key things contributing to this are, again, genetics. Some people are not so optimally producing things such as glutathione, which is our main intrinsic antioxidant system. Food, again, we can get antioxidants from our food, from a rich, diverse, colourful diet, which is lacking typically in the modern Western diet. Poor sleep. What we know about sleep is that melatonin, aka our sleep hormone, while it has a huge function in dealing with sleep, it is also a very powerful antioxidant. So when we lack sleep, we lack melatonin, and that it impairs our ability to deal with inflammation. A lack of sleep also has been shown to cause decreased glutathione levels, another factor which depletes our antioxidant levels. And then lastly, the inflammation. So all these things that are contributing to inflammation put a drain on our reserves of antioxidants. So when an additional inflammatory event takes place, we don't have the antioxidants to deal with that because they're already being used up by these factors up here. So when we start to look at this in a picture of these two are inflammatory triggers, and we question why someone hasn't dealt with that inflammatory trigger well and use these two things, we can start to make sense why people start to go down this route of chronic illness in response to these two things. Once we understand why they've gone down that route, we can create a step-by-step plan for them to improve by removing these things, because these are the reasons why they firstly responded this way, but they are also mediating and perpetuating the disease state forward. These two things were one-off events, but it is these factors which are causing the sustained disease state, because it is these things which are maintaining the increased immune activity, the hyper-inflammatory cycle that we see in people, and possible autoimmune state. What we know about the body, it is self-healing, self-regulating, self-regenerating, and it will return to balance if we remove the things that are interfering with that, which is exactly these.